Hello, I'm Tim Dudderidge. I'm a consultant urologist at the Focal Therapy Clinic, and I've spent over 20 years treating men with prostate cancer. In this video, I'd like to talk through some important considerations around the diagnosis and treatment of prostate cancer. Prostate cancer treatment is not always the end of a fulfilling sex life. When you have radical treatment, of course, we can do nerve sparing during a prostatectomy, for example, and sparing the nerves in many men, particularly younger men and those who have a normal sexual function before treatment, can still allow erections to recover, and although it can take about 18 months in total, men will get a good degree of erection when they use penile rehabilitation measures such as the vacuum erection device or drugs like Viagra, otherwise known as sildenafil. These drugs can help to increase the amount of neurotransmitter release when you get sexual arousal and allows erections to return. With focal therapy, far less damage to the nerves occurs, and a much greater proportion of men will maintain or recover erections after focal therapy treatment. And that's because we're very often leaving one nerve completely untreated and the other nerve might only get partially affected by the ablation energy. So I think it's important for men to realise that when they're being diagnosed with prostate cancer and they're worried about their sex life, to know that there are options that can help to maintain sexual function. After prostate cancer treatment, the structures surrounding the prostate or within the prostate can be damaged, and these are the structures that can help erections to form and help ejaculation to happen. The nerves that wrap around the prostate are very important in helping erections to happen, and when your brain is sexually aroused, signals travel down the nerves and end up with neurotransmitter release in the penis. This neurotransmitter release allows the smooth muscle in the penis to dilate and allows the blood flow to come in, and that's how an erection happens. In the event that we damage these nerves during surgery or ablative treatments, this can affect how much nerve signal from the brain gets to the penis and therefore how well an erection can form. However, with focal therapy treatments, much less damage occurs, and so it's possible that erections can still happen after prostate cancer treatment. When you come to see a urologist or a urology nurse about your prostate health, quite early on in the discussion, we may ask you about your urinary symptoms, your sexual preferences and sexual function. We might ask about how your erections are working. Do you ejaculate normally? How often do you have sex? And sexuality is also an important part of understanding your preferences and needs, because when we diagnose prostate cancer, we have to talk about the various treatments, and many of these can impact on your urinary and sexual health. And so understanding what your lifestyle is like helps us to guide you to which treatment might be more suitable, which one might align with your preferences and still successfully treat the cancer. And so it's important when we ask you these questions that you try and be honest and tell us exactly about you and your life, and that will help us to guide you in the future when we know if you have prostate cancer or not. If you've recently been diagnosed with prostate cancer or you're exploring your treatment options, we're here to help. At the Focal Therapy Clinic, we'll talk to you through your diagnosis, explain whether focal therapy may be suitable for you, and help you to make an informed decision about your treatment. You can learn more or arrange a consultation by visiting the Focal Therapy Clinic.